Good morning, everyone. I'm calling in from Indianapolis in the United States, and I have to say that I'm so moved reading all of the places where you're coming from. We know we have this global Laudato Si Action Platform community, but it really is a powerful thing to see all of you coming together and all of us coming together, signing in from so many places this morning. We are at the halfway point of the year. We're actually beginning the second half of the year with our webinar series. Greetings to everyone who's connected from wherever you're at, and to all who will be connected later on and watching us in the recording through our YouTube live stream. My name is Sarah Mundell, and I'm part of the team at the Vatican's Dicastery for promoting integral human development, working for the platform. To get a sense of our global community, we've started already, but if you would like to add your name, your country, and also why you're interested in the webinar on health and the environment in 2 words, please do that now. It's a great chance to be together. This is a topic that touches all of our lives, no matter what our background is, and we'll hear more about it soon. But first, a few practical announcements. First, this webinar is being translated in Spanish, Italian, Portuguese, and French. So anyone needing to follow in one of these languages, please click on the translation button at the bottom of your screen so you can follow in your language. Second, the webinar is being recorded and live streamed through YouTube as well, and only our designated speakers will be visible publicly. We hope you'll save the YouTube link and rewatch it or share it with others later on. Then at any time during the webinar, if you have a question for one of our speakers, you can write it in the Q&A section. I'll be collecting the questions, and we'll try to include as many as we can at that time towards the end of the webinar. And finally, we invite everyone today to join us in this effort to make this truly a global community. And in that spirit, we ask that any comment that you make in the chat be positive and respectful and seeking understanding rather than debating. So in just a few minutes, we'll have an opening prayer, followed by a brief review of our Laudato Si goals, then a greeting from the director of the Laudato Si Action Platform, John Mundell. Then we'll hand it over to Indu Spunardi, who will introduce today's topic and our main speakers, Gary Cohen and Angela Garcia. There will then be time for questions and answers before we conclude with a greeting and prayer. So first, I would like to invite Sister Celine, a medical mission sister from the Catholic Health Association of India, to share our opening prayer. As part of the International Religious Order of Medical Mission Sisters, Sister Celine served as their NGO representative to the United Nations for over a decade. She is part of the Global Catholic Climate Movement, now the Laudato Si movement, and is a certified Laudato Si animator. In the past, she served in MMS hospitals as well as in villages in the health field. Since 2022, she's associated with the Catholic Health Association of India, CHAI, and represents them as one of the 2 member organizations from India in the Laudato Si Action Platform's International Working Group on Health and Healing. So Sister Celine, welcome.
Thank you, Sarah. Namaste, dear children of Mother Earth. We all know there is a delicate balance between the health of the earth and the health of human beings. Nature's sound has been proven being the healing power on the human body and restore its natural balance. Let us enjoy the nature, though virtually. I invite you to play the video. Sarah, please play the video.
Yes, it's coming now. So we'll listen to these sounds from the forest and the rivers and the wind gushing for just a few moments. So Sister Celine, you can please go ahead with our prayer.
Loving, caring God, we pray that our institutions, especially our hospitals and healthcare centers, may grow in the capacity to provide true care and not bring any harm to anyone. May we all understand and value how concrete justice and simple lifestyles make it possible for others to live and flourish. May our consciousness expand to caring for the whole community of life, our Mother Earth and all her children. We make this prayer through Christ our Lord. Amen.
Amen. Thank you, Sister Celine, for welcoming us with this space to remind us of our connection to nature and our commitment to one another. So for those of us who are joining here for the first time, every month, this webinar series brings a new group of special guests who share their expertise related to one of the platform's stated Laudato Si goals. For those hearing about this platform for the first time, it's a digital space and a community that focuses on encouraging the world to join together on a journey of action leading to sustainability and positive regeneration. The platform was inspired by Pope Francis's 2015 encyclical letter Laudato Si on care for our common home, which he addressed to the entire human family. What does Laudato Si mean? It means praise be to you in Umbrian, the Italian dialect spoken by Saint Francis. It comes from his canticle of praise to God for his beautiful creation. He sang as to the sun as his brother and the earth as his mother. And the Pope invites us to follow in Saint Francis's footsteps in recognizing all of creation as deeply connected by bonds of affection. When people sign up on the Laudato Si Action platform, they join a specific sector, like families or parishes or healthcare institutions, for example. And everyone, no matter their sector, works towards the same Laudato Si goals, including response to the cry of the earth, response to the cry of the poor, ecological economics, adoption of sustainable lifestyles, ecological education, ecological spirituality, and community resilience and empowerment. All of the goals come together to also answer the cry of the new generations, present and future. Today's webinar focuses on the goal of sustainable lifestyles as lived out in our hospitals and healthcare centers sector. If you are already enrolled in the platform, our intention is that this webinar can support your journey. And my camera, let me start my camera over and see if that can help you all see me. Sorry about this technical glitch. I'll continue speaking and then I'll work on the camera in a little bit. So this is today's focus brings together sustainable lifestyles and as it's lived out in the healthcare sector. We hope it can support your journey if you're a Laudato Si participant already and you're reflecting and assessing your lifestyles and revising your Laudato Si action plans and putting them into practice. For our new friends and observers, we hope you feel inspired to join us on the journey. In Laudato Si, Pope Francis writes, "Human beings, too, are creatures of this world, enjoying a right to life and happiness and endowed with unique dignity. So we cannot fail to consider the effects on people's lives of environmental deterioration, current models of development, and the throwaway culture." He also writes, "The human environment and the natural environment deteriorate together. We cannot adequately combat environmental degradation unless we attend to the causes related to human and social degradation." And he continues sharing his concern about depleting fishing reserves, water pollution, rising sea levels, premature death. All of these are health impacts that also disproportionately affect people in poverty. So for those of us who take the time to face these challenges, it can make our hearts ache. What can I do personally about the environmental harms affecting health and well-being of my neighbors next door and on the other side of the world? Big challenges require big solutions. We hope that today's presentation sheds some light on the actions that can show how the healthcare system as a whole can bring love of neighbor into the places where human health care and the earth, care for the earth overlap. So now I invite Laudato Si Action Platform Director and my dad, John Mundell, to give us a quick greeting.
Hello, everyone. Can you hear me? Great. Good day, everyone. I'm happy to be with you for our 7th monthly global webinar series on the Laudato Si Goals. We continue to be excited about the growing interest in this webinar series with such a tremendous response from our over 7,300 LSAT participants and beyond. Thanks to each of you for continuing to spread the word on social media and your local contacts each month. Today's topics, as Sarah said, has keen interest to everyone. I've just returned from a trip to Rome to meet with a group called the Ecclesial Networks Alliance for Integral Ecology. And it's a platform that brings together different territorial ecclesial networks that represent such regions and biomes across the globe as the Amazon and Congo basins, the Mesoamerica area, and Asia and Oceania. These networks desire to address issues of environmental degradation, climate change, and loss of biodiversity, and they highlight their impact on local indigenous people and peripheral communities. We know the suffering and challenges caused by impact to human health affects everyone, and I hope today's webinar does its part to begin to highlight this very important issue. So now I'll hand over the program to our invited speakers, starting with Indu Spagnardi, who will introduce today's topic. Indu works on environmental sustainability, palliative care, and health equity issues at the Catholic Health Association of the United States. She has served on the Laudato Si Action Platform Health and Healing Working Group since its inception. Welcome, Indu.
Thank you, John, and thank you everybody for joining us today. Like Sarah and John have said, this month's Laudato Si Action Platform webinar will focus on the link between the planet's health and human health, and why this link gives health and healing organizations a unique responsibility to ensure that their operations are sustainable. We will also discuss responsible medical surplus donation as an example of sustainability, one of the 7 Laudato Si Action Platform goals that Sarah mentioned. It is my honor to introduce the leaders of 2 organizations that have been longtime partners of CHA in the US, in the goal to ensure that when we care for the sick, we are not unintentionally harming the environment in which they live. Gary Cohen has been a pioneer in the environmental health movement for more than 35 years. He has helped build coalitions and networks globally to address health impacts related to climate change and toxic chemical exposure. Gary is co-founder and president of Healthcare Without Harm, which was created in 1996 to help transform the healthcare sector to be environmentally sustainable and support the health and climate resilience of the communities they serve. Since its inception, Healthcare Without Harm has grown to lead and partner in groundbreaking initiatives in more than 72 countries. After Gary, we'll hear from Angela Garcia, who's the executive director of Global Links, based in Pittsburgh, Pennsylvania, in the United States. Global Links has collaborated with CHA and its members for over a decade. Angela has contributed to the original research commissioned by CHA on medical surplus donations and provided input as CHA developed our resources on the recovery and redistribution of medical products. She is an invaluable asset to the industry here in the US, and as an advocate for best practices to ensure our actions improve health and don't cause environmental harm. So now I'd like to turn it over to Gary to start our discussion. Thank you, Gary, for joining us.
Thanks so much, Indu, and thanks to the Laudato Si Action platform for inviting me and for all of you who are joining today. So I want to start with saying that, for a long time, we didn't hear the cry of the earth. We kept thinking that the climate crisis was something that was going to affect perhaps our grandchildren. It wasn't present for us. It was distant in time and place. It was going to affect other people at some future time. And all that has changed in the last few years. In the last week in my country, in the United States, 100 million people were under an extreme heat advisory that is causing spikes in emergency room visits all over the country. There are wildfires burning in Canada, 500 wildfires that are spreading across the United States and making cities in the United States have incredibly bad air quality. We're seeing flooding all around the world. We're seeing the increasing hurricanes. We're seeing drought, especially in the Horn of Africa, where 100 million people are potentially facing starvation. And we're seeing species extinction at a rate that is not seen for hundreds of thousands of years. So the cry of the earth is now present. The climate crisis has come home to us wherever we live. We're also now understanding the cry of the poor. So those people who are living near coal plants, those people who are living near where there is fracking, those people who are living where there is oil drilling, those people are suffering under this economy that is built on fossil fuels and toxic chemicals. People who have pre-existing conditions, who have asthma and respiratory diseases, when these conditions are exacerbated by wildfires and extreme heat and additional air pollution, they are the ones who suffer the most. We also are recognizing that as the planet warms, diseases that are carried by mosquitoes and ticks are expanding their geography. So just last week, we learned that dengue fever, malaria are in Texas, are in Florida, many other places in India, in Africa. The spread of diseases that are brought by mosquitoes is affecting potentially hundreds of millions of more people than before. And we also know that those who already suffer under racial, social, health inequities, they bear the worst brunt of this crisis because they have the least ability to defend themselves. They already don't have sufficient health care. They already suffer from other toxic stresses related to racism and their social situation. And the United Nations is reporting that climate refugees will outstrip war refugees in the next couple of decades. So the reality that we're facing for the very first time in our lifetimes on the planet is that it's not possible to have healthy people on a sick planet. It is not possible to have healthy people in an economy that is built on fossil fuels and toxic chemicals. There are millions of people that are dying from air pollution now around the world, and that is more than double the amount of people that are dying from AIDS, malaria, and tuberculosis combined. So what's ironic, as we're talking about the healthcare sector today, is that healthcare itself is a major polluter. In the United States, the healthcare sector is responsible for 9% of greenhouse gas emissions, and globally, it's responsible for almost 5% of greenhouse gas emissions. To put it in perspective, globally, that means the equivalent annual emissions of over 400 coal-fired power plants. 70% of all of this footprint is in the materials and the products that healthcare buys and in its investments in fossil fuels. And so transitioning away from fossil fuels and toxic chemicals becomes an incredible imperative, not just for Catholic healthcare, but for healthcare all over the world if we want to prevent future disease on the planet. So for healthcare, it is a call to conscience. It is a call to not only center ourselves in our core Christian values, but also in the core values that underpin healthcare. The Hippocratic Oath, the oath to first do no harm. Because what we need to understand is that we are harming people, even in service of treating them. So it requires us to rethink how we run our facilities, the plastics that we buy, the food that we serve, the vehicles that we run. And that gets us to the question of ecological economics. In the United States, the healthcare sector is almost 20% of the economy, and globally, it's almost 10% of the economy. We have an enormous possibility and responsibility to demonstrate how to bring this Hippocratic Oath, how to bring an ethic of ecological sanity and justice into the supply chain. How do we build an economy that has health and justice in its DNA, in its design principles? And that makes us think about all the stuff that we buy. So we understand that the gloves that we may be buying from Malaysia are made with bonded labor, with slave labor, that the stainless steel instruments that we buy from Pakistan are made with child labor, that the plastics that we buy for our IV bags and tubing may be produced in places like Louisiana, where Black people are every day suffering under this enormous weight of petrochemical pollution that is shortening their lives and increasing their disease. What we understand around this and why it's so crucial for healthcare to embed these ideas into our thinking is that it leads us to an understanding of ecological spirituality. We are all absolutely connected on this planet. We see that now. If there are wildfires in Canada, it doesn't stay in Canada, it moves across the United States. All of the pollutants that are circulating around the globe from the toxics that we use, they all go around into the air, into the water, into the fish, into our bodies. We are now, in a very biologically realistic way, we are seeing that we are absolutely all connected. And so what does that mean? That means we have to understand that we have to have compassion for all beings. All beings on the planet are our kindred souls. And so what can we do? Let's get to that. What can we do in healthcare? There is incredible momentum now happening at a government level and at a healthcare level to commit to move away from fossil fuels and toxic chemicals. And in the global level, there are 66 governments that have signed on to an action platform, which is very much aligned with this Laudato Si action platform, which is about decarbonizing healthcare, getting out of fossil fuels to run our facilities and running them on renewable energy, moving away from single-use plastics, getting rid of some of the anesthetic gases that are 2,000 times more potent than carbon dioxide, serving food that's more locally and sustainably grown, moving away from fossil fuels to run our fleets, many other dimensions, making our buildings much more energy efficient. And so there's an opportunity to engage with your governments. 66 governments have signed on to this platform called, what is it called? Yeah, Attach. And so that's one thing that people can do is to encourage their government to join this platform that is now being facilitated by the World Health Organization. The other is in the private sector called the Race to Zero. And that's something that Healthcare Without Harm is leading with the United Nations Framework Convention on Climate Change. And it's basically a private sector commitment to move toward climate resilient and low carbon healthcare systems. And so in our work in our platform called Global Green and Healthy Hospitals, there's all sorts of materials and opportunities and webinars to teach people how to basically detox and decarbonize their healthcare systems. And part of it is also relating to the question of resilience. And so we have learned from COVID, and we're seeing from the climate crisis, that in this collective trauma, we are at the epicenter of response. We hold people who have lost their homes, who have been poisoned, who have been driven from wildfires because of wildfires to the hospital, those who have pre-existing conditions. So we have to understand that we are the anchors for the resilience of the communities that we serve. It's not just our facilities, but we need to be beacons for response and healing in our communities. And that allows us to think about who are the most vulnerable right in our communities, in our, around our facilities, older people, younger people, those who are on ventilators, those who can't get out of their homes, those who are living in the realm of diesel truck routes. So we need to think about how can we support the most vulnerable among us as the climate crisis accelerates. How can we change the purchasing practice that we have to support more local businesses, more sustainable business for our facilities, so that we're building economic sustainability as well as health. We're building community health, community wealth, and climate resilience. And I'll end by saying that we are the first generation of health professionals to understand the climate crisis as a fundamental health crisis for everyone on the planet. And we're the first generation to model the transformation of our systems all around the world to resilience and to a post-carbon, post-fossil fuel economy. And every health professional after us, every health system after us, then the next generation will have to do the same for many, many generations into the future. So our responsibility to embrace the values and the strategies of Laudato Si action platform, to build an economy that has do no harm as its core DNA, that is the opportunity that we have together. Thanks very much.
Thank you, Gary, and thank you, the Laudato Si platform, for inviting me to share a few more action steps that all of us as healthcare consumers, healthcare practitioners, healthcare facilities managers, we all have a role. And healthcare facilities in particular can leverage strategic medical surplus recovery programs to create a circular economy by identifying unused or surplus medical supplies and furnishings that were manufactured to be used to improve or save lives, and get them distributed responsibly to those with less resources so they can be used for that purpose rather than be discarded or incinerated, and all of those resources wasted. So the organization I work for was founded in Pittsburgh in the United States in 1989. And for the past 3.5 decades, our mission has been to improve health for our most vulnerable neighbors. And we do that both globally and locally and as sustainably as possible. Our founding mothers focused on hospital surplus rescue, starting the organization in their own homes and growing over the past 3.5 decades to the organization and operations that we are today. So what can the human impact of surplus rescue and redistribution look like? It looks like Jose, a 100-year-old gentleman on the right-hand side, pictures with his family, and the recipient of one of the hospital wheelchairs that was refurbished by our team on the left-hand side in our wheelchair workshop. Refurbished, why? To clean, to replace worn parts, and to give the quality of life and dignity to Jose and his family. Jose was bedridden. His caregivers could not carry him anymore. And at 100 years old, he had not felt the sun on his skin for over a year, completely changing the care and ability of him and his family to appreciate what nature has to offer by increasing his mobility and dignity with a wheelchair that was being removed from service by hospitals in the United States. Hospital surplus can also, or home care surplus, home care here in the United States, more and more common as we look to move care outside of the hospital facility, can look like a nebulizer or a breathing machine used for young children and older adults, like my father here, which is essentially an air compressor. These can be cleaned and replaced brand new filters, and redistributed, such as in this case, to emergency responders who are deployed and treating Robert's acute breathing issues, which are on the rise around the world, as Gary mentioned, and many of us know, after disastrous flooding in Mozambique. Hospital surplus redistribution looks like a simple mother and child, which would have been a statistic because of their need for an emergency C-section in order to survive. And that was only possible because their doctors had the appropriate surgical sutures needed to perform the procedure, and all of those sutures were rescued from surplus in the United States, surplus that would have been discarded unused. And so in setting expectations for partners on all sides of a circularity model, we recommend focusing on primary care needs, maternal infant care, and basic surgical needs for greatest impact to help guide and focus surplus recovery efforts. So what does the reality of medical surplus look like? Unused consumable supplies from nursing floors, home care, hospice care, simple items, but essential for providing dignified care like gauze bandages, syringes, stethoscopes, and urinary catheters. Durable items such as beds from hospitals, assisted living facilities, and even universities here in the United States, many of whom are updating to accommodate heavier patient weight loads, up to 300 kilograms. These traditional beds do not need to be landfilled. These traditional beds can go on to serve and improve care for others through strategic partnerships. Medical surplus can look like crash carts, pharmacy carts, medicine carts like these, which are being replaced more and more frequently to digitized storage, robots that are distributing materials to improve safety and also efficiency, but making these crash carts obsolete. Obsolete, but no need to be discarded. This clean storage, safe storage, and improved quality of care for partners such as Miranda, pictured on the right, who I had the pleasure of visiting, and the joy that she had in being able to better access her materials that she needs to care for her patients, elevated her level of care that she was able to provide. And there are many reasons that surplus exists in the US healthcare system, the one I know best, but to ensure impactful redistribution, all surplus must be sorted and date checked. Because simply because it is surplus doesn't mean it should be donated or redistributed to partners with fewer resources. Respecting the customs regulations of countries where you may be partnering, respecting WHO guidelines and the protocols of our partners means we do not handle any expired product. There are no double standards. We must abide by that and ensure that all materials are evaluated. We ask ourselves and our surplus donors, why is the product surplus? Why is it unused? Why is it not wanted at the source? If the clinicians do not want or use it at the source, is it a necessary product? Can purchasing decisions be made at the source to eliminate that product? Would recipient clinicians want the product? All of these questions must be addressed before starting surplus rescue and redistribution. Is the surplus appropriate to the culture, the climate, and the capabilities of the receiving partner? Equipment-specific supplies, such as those that must be used with specific infusion pumps or feeding pumps, they cannot be used by many of our partners who are used to and require gravity drip infusion. Is it the preference of the receiving partner? Do they prefer disposable gowns and drapes made of plasticized textiles that will end up being incinerated and further contaminating the environment? And potentially using reusable cloth that they can launder and re-sterilize. These questions must be asked so we are not perpetuating the cycle of distribution of materials that will either not be used or be incinerated and cause more issues. What sizes are donated as surplus, and what sizes do our receiving partners and end users want, need, and prefer? Do they need pediatric supplies? And we have adults. Do they need small through large size scrubs, patient wear, other attire? And we are receiving in surplus XX through 5 extra large materials. Can the item be difficult to source locally? Many of our partners, such as those here in the highlands of Bolivia, cannot access high quality stretchers, beds, bassinets, and chart racks, and therefore prioritize and value our ability to rescue these same items for reasons mentioned earlier and allow them to improve their care and their services. Whether responding to a natural disaster or responding to the disaster that we are living in, the environmental disaster of daily living, we must avoid contributing to the disaster after the disaster. This distribution of materials that are not requested, that are not needed, and that are not prioritized in the right moment. We cannot contribute to pushing a burden of disposal or storage to partners and people in need with less resources to handle and manage those. It is essential to ask the people with less resources, the community needing assistance, and the healthcare providers working in that area. It is essential to work with people who have relationships and actors familiar in the area affected, whether that is, again, a disaster or daily operations. If we are looking to respond, we must ask ourselves and our partners in the affected area before collecting and shipping materials, are there unmet health or medical needs? Can those materials be sourced in the local market? Would shipping new or surplus goods at the time of disaster be advisable, or is cash donation best? Do we have materials that cannot be sourced easily by our partners? Is now the time to send those? Whether a disaster response or ongoing relationship, transparent, ongoing communication and respect for local economies, local preferences, and protocols are essential. We must always consider the environmental impact and the cost, both environmental and financial, to ship. So how to get started with medical surplus recovery and redistribution? First, establish clear relationships with and protocols with the healthcare facility that will be rescuing the surplus. What surplus will be collected? Where? By whom? In what department? Secondly, establish a clear relationship with who will process the surplus, who will convert the surplus from materials to life-saving and life-improving donations. And medical surplus recovery organizations such as Hospital Sister Mission Outreach in Springfield, Illinois, or other organizations like ours who have the capacity to collect, then sort, pack, and clean all surplus and manage the logistics efficiently and the recipient relationships meaningfully is essential. Third, have a clear agreement and alignment between the surplus donor and the surplus recipient. What is not needed, as well as what can and cannot be provided through surplus rescue. Whether this is working with a local charitable clinic, a community hospital, or a global partner. And we must work with our international partners, our clinical partners, to prioritize, to receive their feedback, listen to them, and have regular communication so that we provide exactly what they want and need so that all materials are received and able to be put into service immediately, not contributing to the aforementioned disaster after the disaster. Once all partners are in place, how do you start collecting surplus? We recommend start small with one department, one product, and scale after getting feedback from the surplus collectors to the processor to the end users. Medical surplus should not be discarded unused if it can improve health, mobility, and dignity of our most vulnerable neighbors. But to avoid wasting resources, or even worse, shifting a disposal burden to our partners, we must be intentional. We must have clear and transparent communication and establish robust people-based partnerships first. Isn't it better to start small and save the life of a single mother and child with targeted donations rather than to start collecting mountains of materials and then try to find a home for them?
Wow. Thank you so much, Gary and Angela, both of you. It just opens up such a wide view of all, for me, another aspect that I am less in touch with about what goes on behind the scenes with all of this surplus, and also the need for this person-centered approach, one-on-one, addressing that mother and her child rather than sending a mountain of things that might be a burden for a community later on. It's just many aspects to be thought about. I think it calls us to more deeply reflect not only what do we give, what do we share, we share our needs, but also how are we doing it? Is it love for our neighbor? Is it living as putting that message of our faith into practice in those relationships? So, and there are so many aspects about healthcare that we could talk about. There's questions coming in that maybe won't be addressed in today's program, but we can put in for a future webinar or connect you with other people in your sector later on. But as we prepare for questions and answers, if anyone does have a final question, you can add it in the chat or the Q&A now. While we're waiting for those last few comments, we do want to post a link to the Laudato Si Action platform just in case you're interested in signing up, receiving our newsletter, or joining one of our sectors. And then so if we've got everybody on camera already, all ready to go. I think the first question that has kind of come out, because this, first of all, if you were looking for a link to Global Links or also to Healthcare Without Harm, those have been put in the chat, and maybe we can put those again in the chat, and we'll make sure that that goes in our follow-up email so that you can connect with them. Is that the best way for people to get in touch with both of you? Or with your organizations? Is that a good place to start? Or where is the best place to start for an organization that wants to connect?
I'll just speak first. Yes, and we have this global network called Global Green and Healthy Hospitals that has partners across 82 countries. There's like 2,000 institutional partners representing 60, 70,000 hospitals. So it's a very big network. And what's interesting about that is that innovation can come from any place. So something that might be really innovative in South Africa or the Philippines or Mexico can be shared across the whole network. There's many, many tools there. There's links to what's called a Nurses Climate Challenge so that we can educate nurses as advocates and they can educate their patients and their communities. So there's many, many resources. The other one is called healthcareclimateaction.org, which has a global roadmap around decarbonizing healthcare. It has a free measurement tool so that any hospital or clinic in the world can measure their climate footprint for free. So there's lots of stuff for free. There's no impediment now for anyone anywhere in the world to start working on these issues.
And I will add that CHA, Catholic Healthcare of America, the studies that were referenced, has an amazing library of free tools as well, specifically addressing surplus, rescue, and reuse partnerships and where to get started. We actually participated in those as was in compiling those, but also we use those in training our own staff. So I'm going to refer anyone that wants to get started on surplus, rescue, and reuse to those materials. And I think you were going to provide some links. And if people are, interested in getting started and don't have a partner, there are other organizations besides Hospital Sisters and Global Links, and we look to make an introduction to whoever is closest geographically to your facilities because of the environmental impact. We will not be looking to make contacts to California, to the East Coast. We want to connect you with someone as close as possible.
And I just want to say, Angela, thanks for referring to those resources. I put them in the link chat, but this is a really active chat, so you might have to search through it. So hopefully Sarah can send a follow-up email to folks with all these links. Angela has been a great partner, and Gary Cohen. I can't believe, Gary, I think you've been working with the Catholic Health Ministry for over 20 years. And I just want to say, Healthcare Without Harm and Global Links aren't Catholic organizations, but they are organizations that share our values and our commitment. And I think that's part of what is so special about Laudato Si. It's addressed to all men and women of goodwill. And I think, Pope Francis has called the Catholic Church to action, but we have to partner with everyone who shares the same goals. And the partnerships we've had with Gary and Angela's organizations have just taken our work to another level. So we're so appreciative to have worked with you all. And I just can't say enough about the resources from Healthcare Without Harm and Angela's work with us and our resources. CHAUSA.org is our general website. And if you go there and look under global health, you will see a lot of the resources that Angela talked about.
Great, this is fantastic. And it touches on some other questions that are coming up. Someone's asking, are you interested in collaborating with multi-faith efforts? And the Laudato Si Action platform is predominantly Catholic, but it's really for everyone. Pope Francis's message in Laudato Si of care for our earth and care for the poor, he addressed that letter to everyone. So we're so glad to be able to work in this kind of faith-based, values-based community that can bring us all together beyond our backgrounds. Because it is an action platform, my thought always comes back to, okay, we're encouraging our participants to set goals and evaluate where they're doing. And if I'm starting out in this process, as an organization trying to connect what might be some concrete action items that I can start with to propose to a working group in my healthcare facility or something like that, would you recommend as kind of concrete action items? And then how do you keep people motivated once you start?
Yeah, I mean, I'll say something on that. I mean, people should talk to their leadership in their clinics, in their facilities. What are we doing about climate change? Helping people to understand that fundamentally it's a health issue. See, the thing is that we've lost a lot of time here in addressing this crisis because we've thought about it as some sort of technological solution, and we've used language like gigaton reduction, and doesn't connect with people. But when we talk to people about the climate as a health issue, as a health crisis, but also as we address our use of fossil fuels and toxic chemicals, we're actually going to improve the health of our patients, the health of our communities. It's the way that people will actually connect to this. And the research shows that the more they understand it as a health issue, the more that they're likely to care and they're likely to act. And who are the best messengers for that? Our healthcare professionals, doctors and nurses and others in the health professionals. So we have enormous power to change the narrative around the climate crisis, to focus on people's health and our core values of interconnection and compassion and love for creation and each other. So there's a messenger quality, there's a evangelist quality that we in the healthcare sector have to begin to educate people, to make this connection. And so I just want to reinforce that as really critical. It's not just IV bags and syringes and surplus materials. It's who we are as healers, and the understanding that in this time and all for future times, that the healing that we need to do is not just individual healing, but community healing and planetary healing. That's the future of healthcare.
I'll add a few action steps because regardless of our role, I am not a clinician. I worked alongside a clinician in rural Mexico and in Brussels, working in senior care. That really was my introduction. And I didn't work in a hospital setting. I didn't see the sophisticated supplies. I saw very, very basic items, everything from incontinence management products for older adults. That is something that isn't, it's not a high-tech issue. The nebulizers or breathing machines that I mentioned earlier, it is a small air compressor. And oftentimes what people think about when they want to start a surplus rescue program from a healthcare facility is not, there's all this stuff, right? We don't want to throw this away. We're just doing it. Don't start with all the stuff. Start with an issue that resonates, whether you as a consumer, respiratory health. I'm here in Pittsburgh. Our old industrial history means that many of my older relatives have respiratory problems, which were extremely exacerbated by the forest fires. The air was actually painful to breathe, which is very unusual here. We have cleaned up a lot, but those machines, as a consumer, that program we have just to reuse those items, free and charitable clinics across the United States can request refurbished machines for their patients rather than ordering new. An air compressor is an air compressor. If we clean and refurbish those rather than having another one manufactured, that is something, and it doesn't involve a hospital at all. So whether we're the consumer that has one to donate, and you can find our Breathe Hope program, and you can package that up and get it to us, we'll then get it to free and charitable clinics. Wherever you live in the 50 states, if you live in the United States, if you have free and charitable or lookalike clinics, we work with everything from our Catholic free healthcare clinic here in Pennsylvania, several of them, to FQHCs and charitable lookalikes. They can join our program, very minimal fee, and request those reused nebulizers rather than do one. So you can be that, again, that advocate, sharing information about resources that aren't commonplace, because unfortunately we think about, let's order this, that's what always has been done. but there are more programs for whether it's reuse or re-sterilization or recycling to get materials reprocessed. There's a lot out there that doesn't require purchasing new product.
Great, thank you. And I think that response of reaching out to your networks is valid to anyone across the globe too, is start talking to people. I would imagine, you know, who are those partners in your community that could connect you, connecting the resources with what is needed. There are more questions, but unfortunately we don't have time to address them all today. Thank you everyone who shared a question and that it got answered, and also to those who shared questions that we weren't able to answer yet. We hope that you stick with us and we'll continue the conversation as we move forward. Thank you to all of our speakers. You shared some great opportunities and provided a lot of food for thought. I'm really encouraged by the stories that you shared and the concrete actions that you shared, and that's something that I can share with others also who are in this field and bring about in my circles of connections. We do want to make a few announcements before we conclude. We have just a few more minutes. So first, Laudato Si Action Platform, some of our team, including John Mandel and I, will be at World Youth Day in Lisbon in Portugal at the beginning of August. If you think you might be there and you want to connect with us, write us at info@laudatosiactionplatform.org. We would love to connect at World Youth Day. Next, we have Season of Creation. We already announced the resources that came out at the beginning of June. We want to remind you it's never too early to start getting ready for the Season of Creation, and you can find the resource guide at www.seasonofcreation.org. And again, if you're interested in staying in touch, please sign up for our newsletter, or if you are inspired to enroll in the platform, visit laudatosiactionplatform.org. More thanks. We want to give thanks to everyone who came to join us today, those who will be watching us later on the recording. We also want to give a big thank you to our technical team behind the scenes, the people making this work today, and also our team of translators. We are so appreciative of your service. And then finally, if you are already enrolled in the platform, we always like to offer a friendly reminder. Don't forget to submit your reflections, your action plans, and share your stories and your photos about what you're doing where you are so that we can spread the message and share that with others to encourage us all along this journey. Finally, our next webinar will be on August 11th, Thursday, August 11th, and we'll focus on young people as essential partners of the Laudato Si Action Platform. So look out for an email with more information. Finally, to conclude, I'd like to invite John Ritz on screen to share our closing prayer. John is coming to us from Ottawa, Canada, and has held a variety of senior leadership positions, which have taken him on a journey across the healthcare continuum. These various roles have focused on implementing strategy and leading major change initiatives. John is currently President and CEO of the Catholic Health Alliance of Canada, CHAC, which brings together 14 owners of 129 health organizations with Catholic identity in Canada. So John, we welcome your prayer now.
Thank you very much, Sarah, and hello, everyone. I'm speaking to you today on the traditional and unceded territory of the Anishinaabe Algonquin Nation. And this is a prayer for healing of the earth. We are called to live in solidarity with all peoples. We are called to respect, protect, defend, and nurture the oneness of all God's creation. God made this earth as a true gift to children of all nations. There is a relationship with all things of the earth and universe. This is our common home. The moon and stars, the sun, the wind and water, and the land. As people of the earth, we share with one another each and every day. God gathers us together in this place. Jesus was in full relationship with all things of creation. Jesus used mud from the earth to heal the blind. He went into the wilderness and to the mountains to fast. He used bread and a few fish to feed thousands of people. He worked with the wind and the water. We learn from Jesus about the way of the healer, friend, prophet, and teacher. Ecological conversion, as taught by Pope Francis, requires the promotion and respect of human rights, individual and collective. People of faith are to be inclusive and welcoming of all peoples and are to advocate for a way of life that is dependent on the land and are to defend the rights of persons who are victims of exploitation. So let us pray together to conclude this wonderful session together today. O God, great Spirit and faithful Creator, with your humility, we, your children, acknowledge the relationship of all living things. For this, we thank you and we praise you. We call on you, great mystery, to be our teacher and prophet. Help us open our hearts to all of our brothers and sisters, and with them to grow in wisdom, honesty, courage, and respectfulness. Give us the honesty to recognize that the earth provides us with life-sustaining breath, nourishment, and healing, and give us the strength to proclaim by our words and actions that the earth is a blessing for all peoples. May we seek the righteous way of love, service, and healing in all things. As we walk our journey on this earth, may the life-giving Spirit protect and guide us with wisdom so that we might live in right relationship and in harmony with all humanity. Maybe we pass on to future generations this earth and all the gifts that have been provided to us. Amen.
Amen. Thank you so much, John. And thank you, everyone. And we hope to see you again in August. Have a great rest of your day, morning, evening, or night.